Hey everyone, it's Misty. Before I start this new series about the gene PNPLA6 and its disorders, I'm going to give you a little background on myself and a little story time. So, as you know, I've been a nurse for 11 years, but the last couple of years, I started noticing that, things were getting a little harder for me. My time management was crap, and I noticed that some of my nursing math I needed to practice a little bit more because it wasn't really making that much sense to me. And I noticed that the probes that you put on patients to check their heart rate, I couldn't remember which one goes where, and I had to keep a photograph in my phone, which I thought was really weird. Anyways, one morning I woke up and I was dizzy, which happens to me a lot because I have nystagmus, which is just when your eyes beat. Anyways, I'll show you later. I went to work and I told my charge nurse, I was like, hey, just letting you know I'm a little dizzy, but I think I'll be okay. If I have to go home, I'll let you know. So anyways, I got report and I started passing medication and assessing my patients. And with my first patient, I noticed that after my assessment and I was putting in the medications, I had to crush the medications for this patient. I noticed that I forgot which medication I crushed or which medication I opened, and I was just like, what is going on? And my CNA with me is like, Misty, you don't look too good. Are you okay? And I said, you know what? No, I'm not okay. I am now a risk to my patients because I can't remember what's going on. So I stopped what I was doing, and my CNA grabbed my charge nurse, and lo and behold, they did a code stroke on me because, I forgot what I was doing. Anyways, went downstairs. Head CT was clear, but head MRI said that I had moderate cerebellar atrophy. So, usually when people have cerebellar atrophy, which is the little brain, they call it the little brain, kind of back here, on the bottom of anyways, I'll show you pictures later. Usually when people have that, they are alcoholics. And so they told me, do you drink? And I'm like, absolutely not. I have horrible GERD. And if I take a sip of beer, even just a sip, I feel like my chest and throat is on fire. So anyways, they had me go see a neurologist, and the neurologist had me check for certain things. I had symptoms of ataxia, nystagmus, but then we found out that my cerebellar atrophy caused mild cognitive impairment. So because of that, I lost my nursing job. So from there, and I'm a veteran of the United States Army, so from there, the VA had me test my blood for, genetic stuff. And I happen to have 2 mutations in the PNPLA6 gene. When you have 2 mutations in it, so your genes, you get one from your mother, one from your father, and I got 2 mutated genes, okay? So that causes disease within the PNPLA6 gene. So that is my story time. That's how I found out I had this. Long story short, many of my symptoms fit one of the disorders called Buschke-Neuhauser syndrome. So I will go a little bit more in depth when I talk about each disorder, but that's how I found out. So I'm not a doctor, I'm not a neurologist, and I'm not a teacher. Okay, disclaimer. But I am a patient, and I am a registered nurse of 11 years who actually suffers from this and has this disease or syndrome. So if you have any questions, just let me know. But anyways, other than that, I'll see you later. Bye.